doing hand hygiene. Hi, my name is Britta. I'm a student nurse, and I'm going to be taking care of your tracheostomy right now. Before we get started, can you please verify that the name and date of birth on your wristband is correct? Yeah? Okay. Perfect. Do you have any allergies that I need to be aware of? No? Alright. I know it can be hard to communicate with a trach in, so if you want to give me a thumbs up for yes and a thumbs down for no, that'd be perfect. And then if you need me to stop at any time during the procedure, just go ahead and raise your hand like this and we'll take a break, okay? Alright, so as I was saying, taking care of your trach includes suctioning, changing your inner cannula, cleaning the insertion site, and then also changing the stabilization collar, okay? We do that just to improve your oxygenation, to decrease your secretions, make you more comfortable, and then decrease your risk of infection. Do you have any questions so far? No? Okay. So I just need to get your baseline assessment before we get started. Are you in any pain right now? No? Perfect. Let's see what else. Okay, so next I'm going to take your vitals. We're going to do a heart rate, O2 saturation, respiratory rate, respiratory effort, and then lastly, I'm going to listen to your lung sounds. Okay. Alright, so now before we get started, I want to make sure that I have everything that I'm going to need. So emergency equipment that should be at the bedside is going to include 2 trach kits. We have one your size and one size smaller. We have a spare inner cannula. We have an ambu bag here. It's attached to 100% oxygen, going at 15 liters. And then I can hear that the oxygen is flowing, it's functional, it's on. And the suction is also functional and on. It's at 120 millimeters mercury, okay? Alright, and then for equipment that I brought in with me, we have a drape for you. I'm actually going to put that on you right now so that I don't forget. We have sterile saline. We have an inner cannula. We have a 12 French cath and glove kit. And then we have a tracheostomy cleaning care tray. And lastly, we have goggles and a face shield for myself. So I'm going to put those on right now. And then I am going to, I have gloves on already. I'm going to wipe off my bedside table now with the chlorhexidine wipes. Okay, we're going to let that dry for 2 minutes, and we're going to repeat. Okay, and it's going to dry for 2 more minutes. So now we can put our supplies on the table that we're going to need. Okay, so I'm going to discard these gloves. I'm going to do some hand hygiene, and then I'm going to put on clean gloves. And now I'm going to open up the catheter kit very carefully and remove just the basin, touching only the bottom. Okay, and next, touching only the paper envelope that it comes in, I'm going to remove the actual catheter. And then I am going to attach it, only taking out the white end of the catheter here. I'm going to attach it to the suction that's already on, 120 millimeters mercury. And then I'm going to place it against the wall, a safe spot, just for now. Okay, and remember that if you need a break during this time, we can definitely take a break, so just raise your hand, okay? Before I take off my gloves, I'm actually going to remove your oxygen mask. And we're going to hyperoxygenate you for just a couple breaths. So we're going to do 1, 2, 3 breaths, okay? I'm going to place that to the side. Okay, so now I'm going to take off my clean gloves, perform hand hygiene, and I'm going to put on, oh wait, hang on. I need to use the no-touch method to put the saline into the basin. Okay. So now I'm going to do hand hygiene and put on my sterile gloves. so I'm sterile now, and with my non-dominant hand, I'm going to touch only the tip of the suction here. I'm going to wiggle it free. There we go. Okay, so touching only the end with my clean hand, and with my sterile hand, I'm going to wrap this up, and we're going to make sure that it's functional by dipping it in the saline. Okay, it's working how I'd like, and so now I'm going to insert it into the patient until I feel resistance or they begin to cough. Okay, and now I'm going to slowly withdraw it while I occlude the suction. I'm going to twist as I take it out. Okay, and we're not going to do that for any more than 10 seconds. If my patient needed to be suctioned again, I would clear the line like that, and then I would repeat in 30 seconds so that they have a short break. But it sounds like they don't need to be suctioned again, so I'm just going to clear the line. At this point, I would assess her O2 saturation. Looks like it's okay. If it wasn't, I would hyperoxygenate her with the ambu bag once more. Okay, so now I'm going to properly discard my gloves and the catheter. I'm going to replace the oxygen source. Oops. Okay, and discard this, and do hand hygiene. Alrighty, so next we're going to do the inner cannula. So, with my clean gloves, I'm going to carefully open this. Are you still doing okay, Miss Elephant? Yeah? Okay, good to hear. So, first I'm going to open up the inner cannula and drop it in there, like so. Okay, and get rid of that. Okay, see, and now I'm going to, let me think about this. Okay, so I'm going to put on my sterile gloves after I do hand hygiene, and there we go. Okay. Okay, so I'm now sterile. So with my non-dominant hand, I'm going to remove your oxygen mask once more. Okay, and then I'm going to stabilize the faceplate. And with my dominant hand, the sterile hand, I'm going to remove the inner cannula, discard that, and then replace the new inner cannula. Actually, before I do that, I'm going to remove the gauze as well. Okay, and now I'm going to replace the new inner cannula, stabilizing the faceplate. So, okay, so it's locked in place. And at this time I'm going to assess the area around the faceplate and the insertion site. I don't see any redness, rash, irritation, signs of infection. The faceplate is midline. Okay, so we're going to move on to the cleaning procedure. So I'm just going to remove everything I won't need. And we're going to dump some sterile saline into the basin now. Are you still doing okay, Miss Elephant? Okay. Cleaning away from the wound. And we're only going to use each Q-tip once to swipe once. So we might need to get a couple extras. Okay, and then I'm going to use some gauze dipped in saline to gently clean the skin around the insertion site. And then the faceplate as well, removing any secretions. Okay, and then I'll dab it dry as well with more gauze. As well as the faceplate. Okay, so now I'm going to insert the clean gauze. And make sure that there's no lumps to cause skin irritation. Okay, and now I can replace the oxygen source. Okay. Alrighty, so last but not least, we are going to change our stabilization collar. At this point, I would call in a second nurse to assist me in holding the faceplate. I'm going to do hand hygiene and don clean gloves. My assistant will also do the same thing. Okay, and so we're going to remove your oxygen mask once more. And using just one side at a time. Okay, and then while we're doing this, we're also going to assess behind the neck for any signs of skin breakdown caused by the collar. Okay, we're just about done here. Okay, and then I'm just going to check that I can fit two fingers comfortably in there. It's not too tight, and I'm going to replace the oxygen source. Alright, Miss Elephant, I'm going to take off my gloves. Actually, I can keep them on for now. I'm going to pack up my Trach. Okay. Alright, so now I'm going to take off my gloves, perform hand hygiene, and then I'm going to redo her assessment. Miss Elephant, how was it? Are you doing okay? Yeah? Okay, good to hear. Going to redo your vitals and your respiratory assessment. So I'll do her O2 saturation and her heart rate, her respiratory effort, and then I'm going to listen to her lung sounds again. They sound more clear than they were before, so that's good. Alright, do you have any questions or concerns about how the procedure went? No? Okay. I'm going to have your call light here if you need anything. Don't hesitate to press it. And emergency equipment is on standby. We have an ambu bag still attached to 100% oxygen. We have suction and a clean catheter attached. Let's see, we still have these two trach kits and the inner cannula. And then before I go, I'm going to document the date and time that the procedure was performed. We're going to do the patient's tolerance of the procedure. We're going to do the color, consistency, and amount of the sputum, the vital signs and the respiratory rate, and then finally the assessment of the peristomal site, the insertion site. Alright, so then I'm going to throw away my trash and hand hygiene and leave the patient.